Hello everyone, I am Dr. Aditya Sai. Welcome to our channel at the Shoulder and Knee Clinic. So today we'll talk about rotator cuff disease and rotator cuff injuries. So if you see your shoulder is like this, it's a ball and socket joint. There are these tendons around the shoulder called the rotator cuff, and they are responsible primarily for two functions. One is movement and rotations of your shoulder, and the second is to hold the shoulder together. Now, what's a rotator cuff disease, what's a rotator cuff injury, and what's a rotator cuff tear? So these are all interesting things. So essentially a rotator cuff disease can indicate anything from an inflammation of the rotator cuff or some degree of wear of the rotator cuff to tears of the rotator cuff. So it encompasses everything. Whereas tendinitis is essentially inflammation of the rotator cuff, and a rotator cuff tear is obviously a tear of the rotator cuff. So why do these things happen? What we need to understand in this is the most common rotator cuff tendon to be affected is this one, or the supraspinatus. So the supraspinatus essentially attaches to the bone here around the shoulder. Now the area where it attaches essentially has a deficient blood supply. So majority of rotator cuff issues start in the supraspinatus. Now there are two etiologies of the rotator cuff disease. One obviously can be due to injury, it can be due to overuse, and obviously it can be due to wear and tear or degenerative. So primarily injuries happen in the scenario like somebody has dislocated the shoulder, somebody had a fall, and then after that they are not able to lift the shoulder, the x-rays are fine, and obviously when there are bike accidents or stuff like that. Second mechanism of overuse typically happens in overhead athletes, so who play overhead sports like baseball or for that matter cricket, the bowlers. So they tend to get these overuse injuries, which essentially are wear and tear of the rotator cuff but partial tears of the rotator cuff. Then the third category is degenerative. So degenerative tears of the rotator cuff typically happen in population above the age of 50, and it's generally due to, as I said before, the poor blood supply of the supraspinatus. It can be due to a component due to an impingement between this bone, which is the acromion, and the rotator cuff tendon. So what are these diseases? One is tendinitis, one is impingement, one is bursitis, and one is a rotator cuff tear. So in impingement, essentially the biomechanics of the shoulder are abnormal, so that the rotator cuff starts touching the acromion during overhead activities. So typically between 90 to 120 degrees of abduction of the shoulder, an individual will get pain at the tip of the shoulder. That's a hallmark of an impingement syndrome. Also, some individuals will have bursitis, that is an inflammation of the bursa between the acromion and the rotator cuff, which can lead to pain, difficulty in sleeping in the night, and restriction of movement. The third pathology is a tear. So tear typically, it's two varieties. One is a partial tear of the rotator cuff and a complete tear of the rotator cuff. So partial tears typically will cause a lot of pain in the shoulder, pain in the night, restriction in the shoulder movement. Whereas complete tears, they will typically cause weakness in the shoulder. So you will not be able to lift your hand fully without support. So suppose you are trying to lift your hand, it will go till here, and then if you push it, it will go completely up. Without that push, the individual will not be able to get the hand up. So that's something very typical of a rotator cuff tear. Pain in the night is a very common finding in individuals having a rotator cuff problem or a rotator cuff disease. So if you are having difficulty in lifting your shoulder, if you are having pain in the night in the shoulder, do visit a shoulder specialist to diagnose your problem properly. So now coming to the preventive aspect of this. So how do you prevent this? So obviously, as you are mobile, as you keep on working, you have to do your professions. So somebody is a barber, somebody is a shearer, somebody has to lift heavy objects. So at some point of time you are going to get certain issues with your shoulder. So how do you prevent that? Most important thing to prevent shoulder injuries is actually regular exercise to keep your shoulder in shape. And by exercise I mean strength training, focusing on correcting your shoulder posture, improving your upper back strength. This is typically very important for people who are doing desk jobs, because throughout the day they are sitting, working like this, so their shoulder posture is rounded and they tend to get more impingement in the shoulder and pain in the shoulder joint. These exercises improve your posture, especially the back. Core exercises improve your shoulder strength, exercises to improve your rotator cuff strength. So they all improve your shoulder biomechanics and decrease the risk of you having a rotator cuff related issues. Suppose now you have already started developing the problem. So obviously I would always suggest that you meet shoulder specialist before jumping into the treatment. But primary treatment is with physical therapy to improve the shoulder posture, biomechanics, to improve your rotator cuff strength. And if physical therapy doesn't help, then we need to look at next level of options. In addition to physical therapy, you can also consider icing your shoulder. Mobility should never be restricted in the shoulder. So whatever movements you are having which are pain-free, you should always continue doing those movements. Now let's say physical therapy has not worked. Then the next step would be to get an imaging study done, to do an MRI to see what's going on in your shoulder. So let's say there is a diagnosis of bursitis or tendon inflammation in your shoulder. Then in that scenario, a shot in your shoulder, that's a steroid injection, generally helps in decreasing your pain and accelerating your recovery. Again, steroids do not treat anything in your shoulder. It's not compulsory. But if you are having a lot of pain, you are not able to manage the physical therapy, then rather than taking pain medicines on a regular basis, this is a far safer option. There has been some news about PRP with regards to shoulder joint. At the shoulder and knee clinic, we generally don't advise that, because sometimes it can lead to a lot of stiffness and inflammation in your shoulder. Although it resolves, but it's quite painful. So we stick to physical therapy or steroid injections. Now let's say these two problems have not worked and the MRI shows that there is impingement in the shoulder. In that scenario, a small surgical procedure is done, which is called acromioplasty, which shaves off this bone which is more prominent, decreasing the impingement. Based on what the MRI findings says, further treatment can be done. So let's say there is a rotator cuff tear. So through arthroscopic surgery or keyhole surgeries, we can repair these torn tendons back to the bone so that they heal properly, and over a period of time you get a good function in the shoulder. A lot of times there is inflammation of the biceps in addition to the rotator cuff disease causing pain in the front of your shoulder. So when we do the arthroscopic surgery, the biceps inflammation can be addressed through either cutting the biceps tendon or denuding it, that is fixing it at some other point. So all these are surgical options which give a good result in the long run, have a good fast recovery, so that you are able to manage with good shoulder function. So these are all treatment options for management of rotator cuff problems, especially surgical treatment options where through minimally invasive surgery we can correct the problem. Obviously, our priority when we deal with a rotator cuff disease is to start with physical therapy, then go on to the next step of injections, and obviously then there are surgical procedures. If properly treated, outcomes of rotator cuff disease are very good, and in the long term people are able to lead normal lives, they are able to sleep normally and enjoy full functions of the shoulder joint. So if you liked what you saw, if you like what you heard, then subscribe to our channel, and you can obviously share our channel. Thanks for watching and keep tuned in.